Hi everyone, my name is Sarah Trello and I'm the Senior Program Coordinator for the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We are very excited to have you here today for our session titled Financing Opportunities to Hi everyone, my name is Sarah Trello and I'm the Senior Program Coordinator for the Southeast Mental Health Technology Transfer Center's School Mental Health Initiative. We are very excited to have you here today for our session titled Financing Opportunities to Boost Mental Health Services in Schools in 2023, the Bipartisan Safer Communities Act. And before we get into the session, we do have a quick disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policy of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short, School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4 that you see pictured here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And we do want to let you know that at the conclusion of this webinar, a link to an evaluation form will appear in the chat box. If you could please take a few minutes to provide us with your thoughts so we can continue to offer free webinars like this. And now I'm going to introduce you to our speakers today. Orla Kennedy is a senior policy analyst for the substance use disorders team at Community Catalyst, where she advocates for policy changes to improve substance use disorders treatment and recovery support services and promote alternatives to incarceration. Orla has experience in policy research and analysis, community engagement, and technical assistance. She is passionate about health equity and improving health outcomes for underserved populations. She has a Master's of Science in Public Health from Johns Hopkins University and a Bachelor's from Providence College. Lena O'Rourke is founder and principal at O'Rourke Health Policy Strategies. She is an experienced healthcare policy analyst and strategist focused on expanding access to high-quality, affordable health insurance and Medicaid. Her work focuses on national and state policy campaigns to influence legislative and regulatory policy. She leads the Healthy Students, Promising Futures Learning Collaborative, a project of Healthy Schools campaign. In this role, Lena provides support directly to state Medicaid agencies, state departments of education, and school districts on policy opportunities and choices to expand and enhance school-based Medicaid programs. Dusan is an associate director of the Substance Use Disorders and Justice Involved Populations Program at Community Catalyst, as well as an individual with lived experience of substance use disorders. As part of the program, he assists in managing initiatives to ensure that affordable and appropriate prevention, early intervention, and treatment services are available to all. Originally trained as a health economist, Dusan has gained most of his experience in working with communities directly. He holds a master's degree in health economics and analysis from the Heller School at Brandeis University. And now I'm going to hand it off to our presenters for today.
And so here are the Oh, and this is great. We have our recording prompt. Perfect. Here are our learning objectives for today. So by the end of this webinar, participants will be able to identify key federal opportunities from the Bipartisan Safer Communities Act for financing school-based mental health and substance use programs for young people. Participants will be able to identify strategies for engaging leaders at the school, district, and state levels to effectively leverage these opportunities. And then thirdly, to identify ways to meaningfully engage youth when leveraging these federal financing channels to improve school-based health services. So we'll be talking more about each of these objectives throughout the discussion today. Now, so Community Catalyst, as Sarah said, Dusan and I are both from Community Catalyst, and we are a national nonprofit health advocacy organization that builds community leadership to improve the health system. And specifically, our substance use disorders program advocates for public health responses to substance use instead of criminalization and punitive approaches. And one of those areas that we really focus on is through youth prevention and early intervention in schools. And so strengthening school-based health programs is one of our key priorities. And that's the perspective that we're going to be bringing to today's discussion. And today's discussion, we're all going to talk about financing opportunities to boost mental health and substance use disorder services in schools by paying particular attention to the Bipartisan Safer Communities Act. And first, we're going to go into a little bit of background before we get into the detail of today's discussion. So first off, and we know that nobody on this call needs any convincing about the magnitude of the problem, but just to set the stage, as we all know, we're continuing to face a youth mental health and substance use crisis, and youth overdose deaths are rising faster than the adult population. So even as we face as a nation a growing overdose crisis, we're seeing particular increase among youth. And suicide is among the top 3 leading causes of death for youth and adolescents aged 10 to 24. And just 20% of children with a behavioral health need are able to get that care from a mental health provider. So there's a huge unmet need among young people. And COVID is making this even worse, particularly affecting LGBTQ+ and BIPOC youth the most. So there really is a critical need to strengthen our services for young people. And so as far as what we can be doing right now, as you all know, adolescence really is a critical time for preventing and treating both mental illness and substance use disorders. And youth are more likely to access services and complete treatment in schools. And so meeting young people where they are, there's really all the more reason to make school health programs as robust and as strong as they can be. And in terms of the federal context, and again, this is likely not new information to most of you here, but in the past, there really was limited focus on Medicaid coverage of school health services. And in 2014, we did see progress with the free care rule reversal, and we're going to hear more about that later. And it seems like most of you are familiar with that as well. But as many of you are aware, this is about expanding Medicaid covered services for all Medicaid enrolled students, not just those with special needs on an individualized education plan. But again, in the past, this was sort of under the radar. There wasn't a lot of federal attention. And in terms of where we are now, many states and local education agencies could be doing even more to leverage federal options to build Medicaid for all eligible health services. And more states could also be leveraging ESSER and Project Aware funds to expand these services as well. And until they do, this misses a really big opportunity to make mental health services in schools sustainable and making sure that all Medicaid enrolled students are getting the health care they need when they need it. And so there is more increased federal attention now, including through unprecedented federal attention through the Bipartisan Safer Communities Act. And so this is really one recent example of the prioritization of improving school-based Medicaid programs through this new law. And I'm going to turn it to my colleague Dusan now to kick off our discussion about the law specifically. So over to you, Dusan.
Thank you, Orla, and thank you everyone for participating with us today. I'm Dusan, pronouns he, him, his. I'm coming from Community Catalyst also. So Bipartisan Safer Community Act, on June 25, 2022, President signed the act into the law. And this is a specific legislation that expands vital mental health services and provides additional support for states and districts to design and enhance initiatives that will promote safer, more inclusive, and positive school environments for all students, educators, and the school staff. So Bipartisan Safer Community Act contains more than a dozen new policies and appropriations, but we will touch on the few provisions that we believe will support young people mental health, substance use disorders, and overall health services, and make them more accessible, tailored based on their needs, the needs of young people, and sustainable. So we will talk about sort of two different, but again, like interplayed buckets. One is expansion of school-based mental health providers, and the second one is expansion of school-based mental health through Medicaid. When it comes to expansion of school-based mental health providers, resources that are coming as a support are two grant lines. One is school-based mental health services grant program, which aim to increase the number of credentialed mental health services providers providing school-based mental health services to students in local educational agency with demonstrated needs. And total funding available there is $500 million. And there was already a first round, so I encourage you all later on when we share these slides to see the list of the recipients and to really see what they are doing and connect with them and all the stuff. In first round, there were 141 million pushed down to 103 states and school districts. The other grant program is Mental Health Services Professional Demonstration Grant Program. And this is really to support like an innovative way of partnership and to train school-based mental health services providers for employment in schools and local educational agencies. Same amount of money, so $500 million. And it's like 46 is already awarded to 67 state school districts and institution of higher education. So basically, over the next 5 years, where this like a when these grant programs will be available, we will see like a $1 billion investment. And to see other funding opportunity, I also encourage you to later on click on the link, which kind of digests all the provisions inside of the Bipartisan Safer Community Act. Worth mentioning that next round of these grant opportunities is coming this fall, and also worth mentioning that at this point, you're probably aware at least some of your states aware that like Bipartisan Safer Community Acts also include $1 billion for Stronger Connections grant program. So this is through Title IV, Part A of the Elementary and Secondary Education Act. Although we did not focus in this presentation on the Stronger Connection Grant Program. However, we will add the slide later on, which kind of explain and digest how some of the provisions under that program can be used to enhance mental health. Note worth mentioning is also that this is a Stronger Connections grant program is not exclusively about mental health in schools. It is more broader than that. So you have like those two opportunities, which are exclusively for mental health, and they're $1 billion. And then another opportunity, which is not exclusively, but also include mental health, including multi-tier system of support and other potential services under the Stronger Connections grant program. I also want to encourage you, since this is going to be a first part when we are talking about grant programs, that please ask your questions in the chat related to grant program, because in the second part we are now moving and switching to Medicaid and sustainability. Back to you, Orla.
Thank you, Dusan. I will put myself back on camera here. Hello again, everybody. So thank you so much, Dusan, for that intro. And in addition to the investments that Dusan just mentioned about increasing school workforce, the Bipartisan Safer Communities Act also includes 3 really critical components specifically focused on expanding and strengthening school-based Medicaid programs. And so along with some of our partners through the Healthy Schools campaign and others, we've started to term this the school Medicaid trifecta, as these 3 elements really come together to support expanding and sustaining school Medicaid programs. And so there's an updated guidance that we're expecting. There is the funding and establishment of a technical assistance center, and there's specific grant money dedicated to expand school-based health programs in states. And so now we're going to go into a little bit more detail into each of these components. So first up is the guidance, and according to the law, this has to be released within 1 year of the law passing. So we expect to see this come out around June 2023. And the law requires the Secretary of Health and Human Services and the Secretary of Education to issue guidance to support delivery of services to students covered by Medicaid and CHIP in school-based settings. And the guidance specifically will include updates to the previous 2003 guidance and 1997 technical assistance guide. It will also provide the clarification of the free care rule reversal about how states can be expanding school Medicaid programs to all Medicaid covered students, not just those with special needs. And then the other elements of the guidance are focused on best practices for reducing administrative burdens. So specific instructions for local education agencies about how to reduce administrative burden and simplify billing. And so it's going to get into some of the real specifics around actual reimbursement for these school health services. And then also it will include best practices and information about how to finance and expand EPSDT services, so early and periodic screening, diagnosis, and treatment, and telehealth services. And then the guidance will also include examples for how to expand which school-based health providers are currently getting Medicaid reimbursement, and how to expand beyond that to take full advantage of the Medicaid financing opportunities. So the guidance will be robust, and we're expecting it to come out with a lot of detail in June 2023. And one more note about the guidance. So since today's topic for our discussion really is focused on financing, we wanted to kind of put this into perspective that the guidance really isn't a new financing opportunity. It's mainly providing clarification and direction for states and local education agencies about how to leverage school Medicaid reimbursement. So it will definitely provide helpful instruction and will be an important piece of making sure states are taking full advantage of school Medicaid financing levers. And this will be a critical piece of sustaining and financing school Medicaid programs. So coupled with the other investments that Dusan just mentioned in workforce and retention of providers and schools, it's really is going to be a critical piece of making sure that while we're increasing capacity on the provider side, we're doing it in a way that's taking full advantage of the Medicaid financing options that are available. Okay, so the other big component of the law is a specific grant funding dedicated for implementing and enhancing school-based Medicaid programs. And so we don't have a lot of information about these grant funding, yet. It is likely to launch late summer, early fall 2023, but it's going to be $50 million for fiscal year 2020-2022, and again for implementing and strengthening school-based Medicaid services. So depending on what is happening in your state, this could be seen as startup funds to lay the groundwork for future further work about strengthening and enhancing school-based Medicaid or depending on where your state is, might be geared towards something more specific on the implementation side. And so we're going to be seeing more information hopefully soon about the specific application dates and how states apply and what that process is going to look like. But just so it's on your radar, we are expecting the grants to be launched late summer or early fall 2023. And now this third element of the trifecta is this funding and the establishment of a technical assistance center. So it has $8 million for fiscal year 2022. And again, this is also something that according to the law has to be established within 1 year after the law passing. So we expect to see it established by June 2023. And it's key that this technical assistance center is actually going to be funded. We all know how essential that is, and sometimes we don't always see the funding coupled with the establishment of the technical assistance center. So that's another great promising piece of the legislation. The goal of the technical assistance center is really to support and increase capacity of state Medicaid agencies, LEAs, and school-based programs to provide Medicaid reimbursed services and be able to receive Medicaid reimbursement for those services. And the idea is also that this would also help foster collaboration between HHS and Department of Education. And there'll be specific support for how states and LEAs can get the funding that's available through the Act. And also there's going to be specific support for small and rural schools. So this is really good as we know about the increased need, especially in rural areas when it comes to young people needing to be able to get the services that they need. So really important that there's acknowledgement of that and specific support dedicated for small and rural schools. So I'm going to turn it now back to you, Dusan, to share with us about how the Bipartisan Safer Communities Act compares to other federal approaches for strengthening school-based health programs like ESSER and the free care rules.
Thank you. So you can look at this from the perspective that both ESSER and Bipartisan Safer Community Acts are sort of a competitive grants, right? With the ESSER, in the ESSER space, they're like distributed by formula. So you will receive. So there is like a whole, and please feel free to look at the resources we will share in this presentation about the distribution and how funds are distributed. But in the ESSER funds, district must use at least 20% of these funds to address learning loss, right? And inside of that, they can use the funds to address mental health. So there is no requirement that will be specifically for mental health. While in the Bipartisan Safer Community Act, there is funding dedicated exclusively for school-based mental health in the two grants I mentioned before, in addition to stronger communities grant, which is kind of playing the role in the same way as an ESSER dollars. And you can look at this through the perspective of overall sustainability. So something where like there is an opportunity for you to improve mental health, like for school districts and then the schools to improve mental health services by tapping some of the grant dollars. And then like on the way, they also like can think about how they can apply for some like grants, which will support through technical assistance as well. They're switching for more sustainable funding, and that is that school fee-for-service, cost-based reimbursement administrative services through Medicaid. Right, so it's a really great opportunity for us to think about, and the collaboration in this space is a key thing, and I will talk a little bit more about that just in a minute. To recap, so the financing opportunity is primarily through the grants funding to states and school districts to kickstart, strengthen their school mental health services. The TA and updated guidance will be useful support for states and school districts about how to make those services sustainable. When it comes to strategies and how can local educational agency or state educational agency leverage these opportunities to improve school-based health services, one of the main things is that collaboration. Even under the specific granting requirement for Bipartisan Safer Community Acts, those grants we outlined before, they are actually asking you to describe how will you collaborate and coordinate with the related federal, state, and local organization and other school-based efforts. So really, like any school mental health financing and sustainability efforts, it's kind of important to engage the stakeholders. And what we recommend, although at this point, utilization of already existing services, it's kind of not clear, and to what degree like young people are actually using mental health services in the school. It is important to say that bringing them early in the game and engaging them through, for example, youth advisory councils or other ways to involve young people in all phases of programming, mediation, financing, and implementation can really boost and kind of destigmatize that arena inside of the school. Because in addition to having like an input, what is the need, you're also having like, in a way, ambassadors who will promote that mental health is a reality and mental health issues are reality, and there is nothing bad with that, and that will reduce a lot of stigma. So, and I know, and I want to notice that we as a community catalyst, we have a youth advisory board for every federal, state, or local advocacy we are doing in this arena. And that is not easy. It's not easy to establish, it's not easy to maintain. It's not easy to kind of have like a dedicated person among your staff who will spend time and engage time, and usually it's not reimbursed. So all that like you're doing, but in the long run, it's a really beneficial, and we see that when it comes to utilization of mental health services in some of the school-based health centers, that the number where like a school-based health centers who are actually having their youth advisory board involved in all the phases, the number of people who are seeking and receiving services are going up. So determine what improvements are needed in the school-based healthcare in your state, district, and local environment. So this is also when we are talking about those grant opportunities, one of the requirements or priority is to demonstrate the need to increase the number of school-based mental health providers. So one way to do that is actually to do like student health surveys, which some of the schools are doing regularly, and really see like what is the actual need in comparison, and use that as a sort of a background for your grant application. Because this is, I'm repeating this all the time, those grants are competitive grants. So you need to justify why there is that urgent need. And in addition to student health service, here it's also like it would be important as a strategy to talk with the other stakeholders, including families, so whole families, parents, and everyone who can help you to kind of justify the need in your local environment. And the third part, if there is a story and you're like thinking about school, how we call it school Medicaid trifecta for sustainability, the first question is like, does your state allow Medicaid reimbursement for school-based health services for all Medicaid enrolled youth, right? And then the second question is, who is delivering those services in schools and not currently getting reimbursed by Medicaid, but could be? And the third one is, what health services are not being provided in the schools to all Medicaid enrolled children, but could be? So there is a lot of opportunity there to actually think about holistically how we can sustain this effort, how we can collaboratively work on it, how we can bring more people in. And something that we always recommend, and it's sort of a simple economic theory, that having people enrolled and retain eligible young people in Medicaid, CHIP, or marketplace plans, so they can have that coverage when service is available. So by promoting that constantly as a school or local educational agency or even state educational agency, by promoting a constant enrollment in the Medicaid, that can bring like a little bit more advantage for you and bring additional collaboration among different agencies, departments, and so forth. And finally, I mean, this is like encouraging people. We really want to encourage you to facilitate that partnership, as I mentioned several times so far, between the state education agency, between health department, between Medicaid agency, to discuss maximizing school-based substance use and mental health services. So make sure that they know about the guidance which is coming in and the grants who are coming in. Make sure that everyone knows that this is a great opportunity. Think about it. So Medicaid as a way of sustainability, $1 billion for increasing mental health providers, and $1 billion in addition to ESSER funds through Bipartisan Safer Communities Act, which can tackle some of the services needed under the Title IV Part A provision in the ESSER Act. So with that in mind, I'm passing back to Orla and Lena to discuss further.
Thank you so much, Dusan. And so we're thrilled to have with us here today, Lena O'Rourke joining us. And thank you so much, Lena, for being part of this discussion. And as Sarah mentioned in the intro, Lena is extremely knowledgeable on this topic and has worked extensively on federal and state policy to expand and strengthen the ability of states and school districts to leverage school Medicaid to support student health and wellness. And she leads the Healthy Students Promising Futures Learning Collaborative, a project of the Healthy Schools campaign. And we're so grateful for her joining us today. And so we're gonna start now with kind of a little bit more of a detailed discussion back and forth about some of these topics that we've brought up already. So the main areas that we're going to discuss now are really going to be focusing on how these provisions in the Bipartisan Safer Communities Act can really work together to strengthen, finance, and sustain school health services. We'll also touch on how LEAs and SEAs can prepare for the school Medicaid grant applications, and then we'll get into some discussion on action steps. So Lena, we can make this more of a conversation style. So my first question for you, and I'll turn it over to you so you can also introduce yourself, or actually let me turn it over to you now so you can introduce yourself and just so folks can meet you for a moment.
Thank you so much, Orla, and thank you to everyone for letting me participate in this today. My name is Lena O'Rourke. I work with the Healthy Schools campaign and support the Healthy Students Promising Futures Learning Collaborative. And in that capacity, I have been working for years to help states really build an ecosystem to support their school Medicaid work. And when I think about that, there are really many different elements of what that ecosystem could look like, but it really relies on a strong foundation between the state Medicaid agency, the State Department of Education, and the local education agencies. And when we're talking here, and I'll help build out a little bit some of what Orla and Dusan have already talked about, but I want to be really clear up front that what we're talking about when we talk about school Medicaid is funding to schools, to the state, and in turn to schools for services that are delivered to a Medicaid enrolled student by a qualified provider in the school. And there are lots of different ways that Medicaid supports student health. But the one I will be mostly focused on, and that the provisions of the Safer Communities Act are focused on, are those district employed or district contracted providers. This is not to minimize the importance of other Medicaid financing to school systems. So mobile health vans, community-based partnerships, where community-based providers come into the schools and deliver services, telehealth, all extremely big parts of financing student health, all important, all equally valid. I'm just going to draw a little box around what I will speak to, which is the Medicaid system that allows for the district employed or contracted providers to bill for the services they deliver to a Medicaid enrolled kid. And then that financing in turn, that additional revenue that comes into the school, can help build out the physical and mental health services that a school delivers. But I want to be clear about what we're talking about, because I think that really helps set the stage for why, as Dusan said, this is, if not a financing strategy, a sustainability piece for how we look at this. So I'm excited. I'm excited to have this conversation, and I'm excited for your questions. Orla, let me turn it back to you.
Thank you so much, Lena, and thank you for grounding us in that context. And I think that's really helpful given our audience and for today's discussion, that it includes also community providers as well as school-based health providers as well. So my first question for you is, taking a step back, we heard about all of the provisions in the Bipartisan Safer Communities Act. That's the school-based mental health services grant program, the mental health services professional grant program on the work side, on the workforce side, and then this Medicaid trifecta through the TA Center, the guidance, and the implementation grants to states. So could you share for us, and in your helpful framing that you outlined in your intro, what's your take on how all of these elements connect to strengthen and finance and sustain school health services?
Yeah, this is really a one-of-a-kind moment in the financing of school mental health services. Speaking from someone who has done this work for years, I have never seen this type of strong and bipartisan support for school health services, both legislatively, both congressionally, and regulatorily from the administration. It builds on the groundwork that was laid during the pandemic and the influx of funds, the ESSER funds, some of the COVID relief funds, but really takes us to the next piece, which are sustained investments and a financial commitment. So we have this unique mix of grant funding, sort of startup funding and workforce funding that Dusan talked about, but it lays a pathway in a way I haven't seen before to move some of the costs, some of the ongoing delivery of services onto the Medicaid side. So by building through the grants and by building a framework to expand Medicaid reimbursement, there feels like an opportunity to really strengthen and finance state and local programs. And in many ways, what strikes me here, your question is, how do these elements connect? It's just the ultimate opportunity for state innovation and incubating new ideas. Because while the federal government in this context, in the programs you've outlined so far, have a lot of framing and a floor of what is to be included, states have so many choices to make to really design programs at the state level and at the local level that make sense for their state, for their community, for their populations. That kind of creativity creates a moment where I think the funds can be harnessed in the short and the long term to really do some good here.
That's great, thank you. And now thinking about how folks can be preparing for these grant opportunities that are going to be coming out, Where can folks find the most updated information about when the school health grants are going to be available, how to apply, some of those details?
Yeah, that's the right question, Orla. And I want to be really clear that I don't have a great answer, and I'm sorry about that. So the Technical Assistance Center and the guidance that Orla talked about earlier in the presentation both have statutory deadlines of June 2023. And I think the agencies will hit that. The grant program under the Safer Communities Act doesn't have a statutory deadline. I agree, Orla, with the assessment you put forward before, that this is a late summer, early fall rollout. I think we will see it then. I know my impression of how this all rolls out is a deep commitment and a deep excitement for pushing this out. So I don't think it'll be delayed, but we don't know the deadline. That said, I think when it comes out, there are lots of ways to get the information and be prepared. And as I imagine we will continue to talk about, there are lots of different players who may get their hands on that information. And the state Medicaid agency, the state education agency, trade groups like Community Catalyst, who really support the dissemination of information, will all be watching for this because we know this is a real opportunity. And so the big thing to me, the prep work in the absence of a specific date, is that getting ready is a big part of that, and staying in touch, in particular to the Medicaid agencies, is it feels critical, because my assumption is these grants flow through the Medicaid agency, although maybe not exclusively. That's, I believe, the locus of the activity.
Great, thank you. And that's actually a perfect tee up to my follow-up question, which is, so given that the grants, so the school Medicaid grants, we know that they're not yet out, and we don't have a lot of information about when they'll come out for sure, what the application criteria will be, the specific eligibility requirements. So that's all up in the air right now. But so still, based on your expertise and what you were just starting to share about the importance of the prep work, what do you think the expected requirements and review criteria will be? What's your take on what would make a strong application?
Yeah, so it's a great question. And I think it varies dramatically from state to state. And I really have no, I really have no special insight into what the grants will look like or what the requirements will be. I wish I did. I wish I could say, here's what this is going to look like. But what I can speak to, with all of those caveats, what I can speak to is what we at Healthy Schools Campaign are recommending. But I'm layering that on top of, Orla, what I see work in states. So what I have seen in the intensive work we've done with state partners that really makes a difference. So to me, and again, this is not based on any special information, but to me, the overall point of this grant program is to enhance and increase state and school district participation in school-based Medicaid. And we are recommending that grants really be limited to and focused on supporting states who are interested in expanding school Medicaid and then implementing that program more. So what can be done with these funds in order to really strengthen and improve the program? And to us, that means expanding outside of the IEP and then implementing the program in such a way as to bring more school districts on board and to facilitate billing and remove the barriers. And that is consistent with the statutory language in the Safer Communities Act, which is that these grants were for the purposes of, let's see if I can remember it, implementing, enhancing, and expanding the provision of assistance through school-based Medicaid. So I think that lines up pretty well with what the legislation suggests. And so I think these grants, a strong grant application would include looking at all of those elements. So for states that have already expressed an interest in expanding school Medicaid, they can really be thinking about in their grant application how to demonstrate that commitment, what they would plan to do to seek reimbursement for all eligible services. Some states, a handful of states, actually are pending approval in how they would strengthen and improve their program. For those states, these grants could play a really important role in the effective implementation of the changes that they're putting forward. States that have already partly expanded could really be looking at how to expand more. So states, for example, that have only expanded outside of the IEP for school nursing services, this is a great opportunity to think about and leverage for student mental health services. How can you bill for those services? And I think the grants would be appropriate to thinking that through. And then those states that have already done a really robust job in creating the policy ecosystem could use the funds and develop a strong application to do a better job with implementation and training and support to LEAs. So I think wherever you are, wherever a state is on the school Medicaid spectrum, there is an opportunity here to really lean in and develop an application that would further the goals of this program. Let me stop there and see if that helped, or if you want me to clarify anything more.
No, I think that's a great great context, and I think this also links back to what Dusan was sharing, that there is a specific requirement through the Bipartisan Safer Communities Act that even though we don't know the specifics on the application criteria, it is named through the law that states do have to be showing that they're going to be collaborating with other agencies in their states and the state and local agencies, and what else is happening in their state. So it seems like that kind of all fits into what you were saying about getting a sense of what's already happening and then how the state would use these funds to build on that. And I'll throw in another plug there for what Dusan was mentioning about the importance of youth engagement as well, and incorporating youth needs and their perspectives into those decisions in terms of responding to the applications. So let's kind of similarly on the same topic, let's talk a little bit about some ideas for how states could be using these funds. And you started to mention this in your answer. So based on what we know so far and your experience, what are some potential ways that the funds could be used to strengthen school mental health services, even across the continuum of kind of where states are in different places? We know that. What are some of the ways that they could use these funds? And yeah,
totally. And I'm going to answer your actual question, but I'm going to pull back a tiny bit and put it in the context of everything I'm about to say is appropriate whether there are grant funds or not. I think all of the things that I will say are if not best practices, at least promising practices in terms of really figuring out how to do this. And some states have been lucky enough to get state legislative funds or dedicated Medicaid funds. So there's lots of ways to finance this. So I think about this for the grant program in particular, but there are lots of ways to support the development of a strong school Medicaid portfolio. And so the kinds of things that I would really love to see, and I think are appropriate under what I hope the grant program will be, but even beyond that, I would hope we can all be thinking about how to fund things like hiring dedicated staff at the state agencies to oversee the program and the expansion and the implementation, with a specific focus on providing technical assistance to LEAs. How does the program work? What does that do? How do you build out the training requirements? All of that works best in practice if there are dedicated staff, which often takes funding. And that element of technical assistance to the LEAs and in turn to the specific providers who work in the school district, providing support and resources to actually implement the program, to do the training and the implementation is critical to the overall success and to the billing of Medicaid reimbursement. Related, I think money is well spent on coordinating and staffing to ensure that the agencies work together to put out consistent guidance so that the state environment is complementary and really focused, like laser focused on supporting the schools as the delivery system. And that's tricky to do, but I think we have seen across the country states that have done this well and provided support for the explicit coordination in order to support the schools and the providers. I think additional focus under that for small and rural districts so that they can fully participate in this program is important, both as an equity issue and for a fulfillment of the goal here. Being able to dedicate specific resources to a wide range of the LEAs, but really focused on the small and rural school districts who have not participated or have a lot of barriers to participating in school Medicaid. Convening stakeholders is extremely important. School district leaders, superintendents, the school-based providers, the community-based providers with whom the partnerships between the district employed and the community-based providers, convening them to inform the development and the implementation of the school Medicaid program is a really critical step. And it takes at the state level and at the local level. And it takes a lot of work to get all the players together, but it is the only way to really succeed in addressing the unique situation that is delivering a healthcare service in the school and all that goes into that. And bringing the people who really understand that together helps inform and be successful. Finally, just a couple of other things that occur to me. They're smaller, but I think a piece of this, covering the time and resources for updating guidance and training, bringing in the legal experts to deal with some of the privacy and confidentiality issues of delivering services in schools. It's better to do that up front rather than to figure it out after the fact. And the legal ramifications really can influence the design, and it's easy to solve for, but it does need to be part of the equation. And finally, really thinking through, and Orla, you've talked about this. So the fact that I'm putting it last does not mean I prioritize it last. In fact, maybe I'll just lift it up as my last thing. Really thinking about what the students need and what isn't being delivered. What does that landscape look like? Finding out the answer to that question can really help you define all of the other pieces, and starting with the student need and the gaps in care. Grants can be used to support that landscape analysis in a way to make sure that every other layer of participation makes sense.
That's great. And thanks so much, Lena, for continuing to emphasize, the importance of youth voice and youth experience in shaping the plan for using these funds. That's so helpful. Before we transition to action steps, I'm thinking this could be a good opportunity to channel the knowledge and experiences of those here on the call and see if we can use the space to hear from one another about ideas for how these school grant funds could be used. Does anybody here on the call have ideas that are top of mind that you would want to share based on what's going on in your state? Please, feel free to share them in the chat, or we can open it up to a discussion. But wondering, as we get into this discussion, is there anything top of mind that folks want to share about what some really innovative ways could be to use these funds and important ways to use the funds?
If you're interested in using your voice and lending it to the conversation, it might be helpful to us if you use one of the functions in Zoom to raise your hand, and Orla and Lena can call you to unmute your mic.
Thanks, Adam. And it doesn't look like from the participant view that I can see here that anybody is wants to chime in immediately, which is absolutely okay. We're going to have plenty of time for open discussion before the call ends. So if folks want to keep thinking about this question and think about things that they might want to raise in this shared space, that would be great. And we're going to have plenty of time to discuss before we wrap up. But yeah, I'll give another just prompt in case anybody wants to share anything top of mind. Okay, well, yeah, Lena, did you want to add anything else before we move on to the action steps discussion?
Well, I would add the opposite is true too. If any of the things we've outlined feel off the mark, that would be helpful too. We take a holistic look at what we've seen work in other states, but they don't work in every state. So I'd be curious, in addition to where you see the most need for funds so that we can think about how to support that, if there are other things that would not be helpful, that is just as useful. But we can turn to action steps, Orla, and people can weigh in as they do.
Great. Thanks so much, Lena. And yeah, absolutely. If anything feels like it's not resonating in a way or feels off the mark or that we're missing something, we want to use this space to lift that up as well. So thanks so much, Lena. But yeah, let's move to action steps and then we can open it up for any other questions from the group. So even for folks who are very familiar with school health financing, what's the most important action for them to take after we log off from this webinar?
I think we've touched on a lot of them already, but let me lift them back up. I think the coordination and building a table between a table and an ongoing feedback loop between state Medicaid, the state education agency, and LEAs in the state is critical for success in the school Medicaid program. Each bring a unique voice and each play an outsized role in the development of the policies. And figuring out if that table already exists, if you're not looped into it, or how to strengthen that over the next couple of months when we know that as Orla calls it, the Medicaid trifecta is coming down, that'll kick off soon. Where will those conversations be happening? And be sure you're at those conversations. I think the other thing that feels really critical at this time is figuring out what you would want improved in the school Medicaid system. Or actually, I'd even take that one frame bigger, and Dusan can speak to this a little bit too. What do you want in the student health system in a school, not just the Medicaid enrolled piece? There's a lot of different funds to harness. So what is the need? From my lens, thinking about what services, does your district participate in Medicaid if you're an LEA? What services are actually being billed for? What services are being delivered in a school? Like what healthcare services are already being delivered in a school, but are not billed for is a really important question, because that can help you think about where you may want to push a little bit to expand. And what providers are reimbursable in a school setting. So some states, for example, don't allow for billing for school psychologist services, just as one example. But by looping them into Medicaid reimbursement, which, while not simple, is very doable, that can be a really big source of new funding to a school system. So landscaping that and being clear on what the changes to that reimbursement stream are is a piece of this. And again, I defer to Dusan and Orla to talk about how to think more holistically about student need. But those are the pieces from my little parochial view that that are important. And we, the Healthy Schools Campaign does have resources on this. I see Sarah's put the link in the chat. If you're interested in what's happening in your state in particular, which is what everybody wants to know, is where am I on this continuum? The Healthy Schools Campaign does, and Community Catalyst as well, have resources to help you move in that direction, to understand what the system is at the moment, so then you can cross-reference that with where you may want to go. So that's at least one piece of the puzzle. I think that's really important, Orla.
That's great. Thank you, Lena. And thank you, Sarah, for lifting up the Healthy Schools Campaign resource in the chat there. That's a great link that provides some of the overview that Lena shared. And we would imagine too that some of you, yeah, depending on your experience, you're also already well versed in what's happening in your state. But yeah, this can be a helpful resource as well. So Lena, another question for you here, and we know that there in our audience here today that it includes providers that partner with schools to provide services in schools, but are community employed providers. So if we think about next steps for them, what could or should community providers that may be partnering with LEAs and SEA representatives do in order to make the most of these resources that are coming out through the Bipartisan Safer Communities Act? What should they do?
That's a great question. And I think a nice tie back to the whole ecosystem, because again, I have focused so narrowly on the district employed and contracted providers, but the reality is there's lots and lots of different ways that services are delivered in schools, and the community-based providers in so many different capacities are filling those gaps. I encourage the community-based providers to be part of this conversation, because if we keep our eye on the goal, which is as many resources as possible to stretch limited resources further, figuring out that Medicaid piece is a part of it. Thinking about the care coordination in the community and outside the community, thinking about the documentation, ensuring that providers have access to the holistic needs of the student. This is all pieces of it. And the community-based providers work hand in glove with the district employed providers to serve these students, either in a school setting or externally. And this is not pie. This is not where if you move resources by having a conversation about district employed providers, there's less in the community. This is really about coming up with a complementary system that gets, I'm going to butcher the analogy, but we need a bigger pie rather than dividing the pie we have. And the Medicaid stream just supplements the resources that are coming into the school, but it has to be done smartly and well. And having the providers who touch these kids in the same space at the table gives the opportunity to do it. So I think my advice is exactly the same. Build the table, find the locus of the conversation, ensure you have a seat at that, and make sure all the pieces are working together in a comprehensive and coordinated way to move that forward. And Dusan, I see you turned your camera back on. I don't know if you want to get in here and have thoughts on that as well, but I think that's how I see the Medicaid piece of it.
No, I will pass it because we have a question coming from Charlotte. So maybe it's, go ahead, Charlotte, you're just on mute. Yeah.
Thank you. I know that's interesting. I'm executive director of a Children's Bureau in New Orleans. And so we are a community provider trying to figure out how to work. Actually, we're embedding trauma therapy in schools. And the biggest battle, and we're in New Orleans, so we have 83 LEAs. And so you can imagine trying to find a table to have this conversation. But I just wanted to comment because I do think that the thing I'm seeing is if we don't figure out how to coordinate this, the workforce availability to provide services, like I'm at a point where it's like our schools continue to hire social workers and others for mental health, but they're unable, and they pay really high, but they're not doing clinical interventions, obviously, because they're consumed with everything else. So I just, to me, it's a conversation they're trying to have here, but we've definitely, I'm almost at a point of saying, like, we shouldn't, in our community, we have so few resources, and we shouldn't even have community-based providers unless they're in schools, and figuring out how to get that funded and having that conversation. But that's a very, very confusing conversation right now. So I'm glad it's, you know, I don't know how you create a table where the school systems talk to the community providers because it's one by one. So just a reiteration, it's good to hear that that's what should happen.
Can I respond to Charlotte, Orla? So, Charlotte, yes, I really hear you. You know, this gets to greater issues of workforce and workforce development and a desperate need for more providers, and particularly those focused on children and adolescents. And I think Orla and Dusan have talked about the workforce pieces of this and the grants available. And I don't in any way want to minimize the challenge and the need, and to say yes on that. I will say there are a lot of interesting and very homegrown solutions to the coordination between the schools and the community-based providers. In terms of data sharing and information, in terms of health information exchanges and the ability to collect student health data in a unified statewide portal. You know, none of these are perfect solutions and they're so state specific, but they're creative and they're different. And each state is working on that. Since you're in different capacities, since you're in Louisiana, I will say Louisiana is a really interesting example of the school Medicaid. Louisiana was actually the first state to expand outside of an IEP, and they just did it for school health, school nurse services, but it went financially well, so they went back and they expanded to cover all health services, and it has an organizing body around it in Louisiana who is really interested in thinking now about the implementation and the training and the coordination. And I think it's a really great example, even if it is a challenge in practice. So I don't have great answers for you. I don't know if it feels better to know that I really hear you and agree. But I also think it demonstrates the importance of this moment more than anything to figure it out and to really take those concrete steps before, because there are these discrete funding sources coming in. I think it's a real opportunity. I don't know, Dusan or Orla, if you have anything more specifically on the workforce or the grants, because I can't really speak to those.
Dusan, is there anything that you want to add?
I mean, it's just like a lifting up the same thing that Lena said, that it was a grant for the mental health providers workforce. One of the grant requirements is to develop the plan how we do collaborate. So I would encourage you, you can. So one first step for people, all of you at this call, is to really click on that. Who is the list of the participants who got that grant in the first round in this February 16, I believe, 2023. And then look at it. Is there someone coming from your state? If it is coming from it, reach out, talk with them, see how they kind of developed that plan, since it was a requirement. or like think about who are other stakeholders inside of your community with whom you can communicate. So in other words, you can use that grant opportunity to start that collaboration. And at the moment, as Lena mentioned several times, at the moment when you are getting into the place that, okay, let's think about broader sustainability and broader health, mental health, substance use disorders, and health inside of the school. I'm already having a partners in this space. I'm already established like a structure of collaboration. So this is a natural now for me. It's not something that now I need to like do it in a different way in order to tap and receive reimbursement through Medicaid.
Thanks, Dusan. And before we move on from this topic, just because I think it is such a critical question that Charlotte raised in terms of on the implementation side, bringing community providers together into this conversation. Is there anybody here on the call who has any thoughts about what's worked, what hasn't worked in terms of that community provider engagement in the past based on what's going on in your state? You can just give folks a moment to chime in if they'd like to. Okay, well, we'll stay tuned. Maybe if something comes to mind, please don't hesitate to jump into the discussion here. But on that note, I think we could transition to the resources slide so folks have a sense of what other materials are out there to kind of help inform these plans for leveraging the opportunities of the Bipartisan Safer Communities Act. So these are some great resources here. Some of them we've already mentioned throughout the discussion. But yeah, we encourage you to check those out. And following this slide, I think we have our references for some of the other more data-oriented pieces that we shared. But yeah, we're thinking now we could open it up for broad questions. Anybody from anybody on the call, or if there's topics that we haven't yet covered that you want to raise in this space, we're open to that as well. But yeah, thank you so much for being part of the discussion today, and we'd like to open it up for broad question and answer discussion.
Thanks very much. Thanks very much, Orla. Thank you, Lena. Thank you, Dusan. Fantastic content. So I'm Adam Wilk. I'm the Deputy Director of the School Mental Health Initiative at the Southeast Mental Health Technology Transfer Center, which we were very pleased to present that didactic portion of this discussion. I'll also be serving as moderator for our Q&A portion here. So I want to remind everyone that you have a few opportunities to reach out with questions now. You can do it through the chat, and I've seen a couple of people take advantage of that already, and I've got their questions loaded, so I'll be asking those in a moment. And then if you also would like to speak up like our friend Charlotte from Louisiana did, please feel free to raise your hand on the reactions icon in your Zoom window, and I'll be glad to call on you that way as well. All right, so the first question that I saw came in quite a bit earlier in the presentation. It was from Joseph Marlin. I think Joseph is still with us. His question was, how can we make sure we are aware of opportunities in the fall? Dusan, I think this question came up when you were talking about some of the BSCA grant programs and the limited information we have at the moment about some of the fine details. So how best can people be alerted when more information is available about these things?
Yeah, so one way to do that is really to follow Department of Education and their announcements, right, and press release about the grant opportunities. So that's one way, and probably like a harder way to do it. Another way is there is an option like inside of the PowerPoint presentation. You will see like a couple of links on that website which can lead you when that's going to happen. So that's like that's a different option, the second option. And the third one is we as an organization, Community Catalyst, in the next like a year or so, we will working closely, specifically with North Carolina, South Carolina, and Georgia, on kind of trying to build up these efforts. So you can like simply reach out direct to us. I know that summer tends to be a planning period for everyone. So please feel free to reach out to us directly, or through MHTTC, and then they will redirect that to us. So those are a couple. So there is, I would say, unfortunately, there is no like an easy way for that. Another piece is that you can also, as a school, like a school separate unit, you can also like follow and ask your like local educational agency or like a state educational agency when is that coming, and so forth. So they are required to give you like very straightforward answers to that. So if that makes sense.
So very helpful. Thank you very much, Dusan. Thank you, Sarah, for adding the email addresses of Orla and Dusan in the chat here. Please save those if you're interested in connecting with Orla or Dusan directly after this presentation. Dusan also mentioned the links that are available in the slide deck here. Again, the slide deck will be circulated along with a link to the recording of this webinar in a few days after that recording is processed. So you'll have access to all of those links in the final version of the slides in a few days. The current version of the slides is available on the registration page for this webinar today. So you can have access to those links at this moment if you go to the Southeast MHTTC website where you saw our initial registration opportunity. All right, so the next question I saw came from Charlotte Maldonado. I believe she asked her question when Dusan and Orla were talking about the trifecta of leveraging Medicaid in sustaining school mental health programs. Her question was, so will the services just be for students with Medicaid insurance? So I wonder if you could speak to how this grant program opportunity can foster sustainability of these kinds of programs more broadly.
Thanks, Adam. I'm thinking, Lena, this fits well with when you were teeing up your perspective about kind of putting the box around specific focus on Medicaid services and where this fits into robust school health programming overall. Yeah, Lena, what's your response to this question here?
Well, so technically, the school Medicaid program is reimbursement for services delivered to Medicaid enrolled kids. So by a very narrow definition, yes, that reimbursement would only be available to services delivered to a Medicaid enrolled student. And so it is somewhat limiting in that factor. However, if you take a big step back out of that, what we're really talking about is reimbursement to the state and then pass through back to the schools for student health services. And so if we are looking at student health services and if we're looking at the total school budget, the money coming back is there to supplement, not to supplant existing funds. And so the reimbursements can be spent in such a way, and some states, in fact, require how those Medicaid funds are reinvested into school health services. That's a state choice or a district choice. It frees up limited other funds to cover services more holistically. So it is part of the health services ecosystem and the funding for overall health services, even if the mechanism I am talking about is very specifically Medicaid focused. The other thing I will just say, although I don't have a lot of great examples, is increasingly states with support of the federal agencies are looking at opportunities to provide more upstream services. At the beginning, Orla mentioned how the guidance may have more information about EPSDT services, but really thinking broadly about what the upstream prevention factors would be. And while that would still be Medicaid specific, it has implications for students who are pre-diagnosis, for students who are at risk, and potentially, and this is something I think the community needs to explore, how to leverage Medicaid funds for school climate and healthy school environment funding, and for interventions that are much more about the classroom and the school. I'm not sure we've cracked that nut and how to do that yet, but there's clear interest and support from policymakers. But that is, I think, going to take some incubation and some real state and local innovation and homegrown solutions to figure out how to do it. But I think we will be moving in that direction as well. So Adam, to actually answer the question, yeah, this is about Medicaid enrolled kids, but the reason we're doing it is to bring in more new federal resources to support the entire student health program.
That's perfect. Thank you. Thank you all very much. So I haven't seen any additional questions coming in the chat. Again, if you'd like to add them to the chat, please feel free to do so, or you can raise your hand and I'll be glad to call on you. While we're waiting for additional questions to come in, I had another question that's, I think, related to this discussion we were just having about the broader sustainability of these programs. And I think it's also related to something Charlotte from Louisiana brought up a little while ago, and that is concerns about workforce shortages and workforce turnover problems. So these are really big problems that are plaguing lots of school mental health programs and leaders across most every state, and perhaps particularly in rural areas. So I was thinking about these grant programs, perhaps, as a potential mechanism for putting together plans for lots of things related to school mental health. I wonder to what extent planning for workforce turnover and shortages makes sense to include as a part of any one of these grant applications, or perhaps as a part of the broader conversation, including community providers and others, in trying to figure out how to set up this system and how it should be sustained going forward.
Dusan or Lena, do you have immediate thoughts about addressing the workforce turnover piece and how that fits into this conversation?
I'm gonna let Dusan go first.
Yeah. So no, this is a great question, Adam, and thank you for asking it, because it's a very contemporary and ongoing. So I would answer in two different ways. One is what can happen right now, and another one is what is the promise in the future. So what can happen right now that, like, with utilization of these grant efforts and grant money, so in a simple way, you might be able to attract, because they're saying that there is one way is to employ directly in the school providers, right? Whether it's a counselor, social worker, psychologist, nurse, and so forth. Another way is to that collaboration piece with the community-based providers and already existing providers in the neighborhood. Like, so where they can fit to cover that gap. So they're basically, and maybe the best example of that is school-based health centers, right? And how they're like operating inside of the schools, even if they are sort of a separate entity, if you will, right? So that's one way how it can be done. So another way is really thinking about the future, and what we are advocating as an organization right now is to what degree some of the services can be covered and hopefully in the future fairly reimbursed to people who are peer support service providers, right? So that's some piece that it's kind of, I'm saying contemporary because it's happening right now, but there is a lot of momentum that some like a peer support services can be reimbursed fairly and equitably through through Medicaid, through other like a means, and they can be part of the solution for the workforce. As someone with a kind of a lived experience of substance use disorders, I can testify from my own recovery that that whole piece of peer support was probably the crucial piece. You know, if you put aside the first like a couple of months when you really need to stabilize everything and be engaged a lot with the system. So in the same way with the mental health, is after that first stabilization piece, maybe that there is a lot around like a long-term recovery inside of the mental health, which can be covered by peer providers and peers. And third piece, which is kind of related to this, when there is a lot of states nowadays who are kind of enabling youth and young people peer support specialists, and having a curriculum how they can become that inside of the environment, inside of the school environment. So unfortunately, pathways for sustainability reimbursement are still like a little bit fragile, I would say. But more to come, right? So we are hoping for the best, because how I see it personally, that is the only way, because we cannot wait for additional 7 years for new like workforce and new doctors or new like highly educated folks to come in. So I hope that answered your question somehow, but yeah.
I think that's very helpful. I appreciate the insights about what's going on today and how that can be part of the plans that so many different partners in the community can bring together to formulate this larger plan, along with the funding that's coming in through the BSCA. All right, so we're running out of time today. So with that, let me turn it over to Sarah Trello to wrap us up and direct everyone's attention to the chat, where she's posted a few links for how to evaluate this session for us. Sarah?
Yes, thank you. Thank you everyone for joining us today, and to our presenters for this wonderful and very informative presentation. But as part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. So we ask that you please take a moment to complete a brief survey about today's session. After you complete this survey, you will be redirected to a second survey that includes additional information our center likes to collect to continue to improve the quality of our trainings and make sure we are addressing the needs of stakeholders in Region 4 through our programming. We would greatly appreciate it if you take an opportunity to complete the second survey as well, and just thank you all for attending.